Well, thank you, Michelle, very much. And welcome to all who are with us tonight to a Faith That Does Justice. As Michelle said, we really are an organization that really tries to live faith in action. And I'd like to start as kind of an entree to what we'll discuss tonight, which is really a serious topic. About a month ago, we held a community meeting, a large community meeting on healthcare disparities to really point out how people of color, communities of color really suffer at the expense of how healthcare is distributed in this country. And tonight, we really want to look at an action component, living faith in action, that what can we do, perhaps as individuals or in groups, to really try to do something to be able to help people in need as it relates to healthcare. We have a very able speaker tonight to help us or to coordinate this event tonight, and I'll introduce him in just a moment. But I'd like to start by really just talking about what is going on here when we talk about faith in action. Uh, Really, people of goodwill really oftentimes do seek social justice. They do what they can do to help people in need. And I really see two ways of really going about this. One is from a faith perspective. The other is really more from a secular perspective. Both are good, and yet they're a little bit different. From a secular perspective, people feel within themselves the need, the desire for a world that is more just and to work towards that. And we really commend them for doing that. People coming from a faith perspective, and I'm speaking mostly from a Judeo-Christian background, really are coming from what is it within them in their own faith journey that really impels them to really want to move beyond themselves into a world where there is human suffering and to try to speak out and work on behalf of people in need. And in this country at this time, with all of what's going on, we have great need for people who are really hurting, especially people of color who healthcare in particular, which we'll discuss tonight, really seems to leave them somewhat behind. So I just mentioned for a moment, really from the Jewish tradition, we have the great prophets, the prophets of Israel, who challenged the Jewish people over and over again to live covenant relationship, which is to say, really to live as God or Yahweh. It was calling them to live with respect for all people, taking care of the widow, the orphan, and making sure that all people really were not left behind. And from a Christian tradition, we really invoke Jesus and his work on behalf of the kingdom of God. Jesus spoke on behalf of a world where there would be fairness for all people, where there was love for all, where there was compassion at the sight of human suffering, and where there was a sense of justice that reached out beyond people of privilege to encompass all people from all walks of life. And I think tonight that is really what we're talking about. That from a faith perspective, there is that something beyond ourselves that really is calling us to reach out beyond all of what we might be doing on our own behalf to really live the Christian praxis of love, compassion, and justice for all God's people. So with that by way of entree, I'd like to just introduce our coordinator for tonight, who's Chris Noble, who is the Health Justice Campaign organizer at Healthcare for All. We've invited Chris to come and follow up to the meeting that we had about a month ago, where we really did talk about these issues of how communities of color, people of color are really being left behind. So with that, Chris, I introduce you, we welcome you, and we're very much interested in your leading us through this discussion of what we as individuals might do on behalf of people who are really being left behind in terms of healthcare. So Chris, welcome.
Great. Thank you, Peter. And thank you, Faith That Does Justice, for letting me speak tonight. My name is Chris Noble. I'm the Health Justice Campaign organizer at Healthcare for All. I'm going to share some slides to go through, how Healthcare for All approaches health justice, and really what we can all do together and as individuals to help advance health justice. So that's what I'll be speaking about today. There's my name. Let's see, make sure the slides work. Great. So quick background to Healthcare for All. We were founded in 1985. We're a nonprofit charitable organization with the following mission statement. So Healthcare for All advocates for health justice, which I know we've been using that term a lot tonight, and I'll be defining, how we approach health justice in Massachusetts by working to promote health equity and ensure coverage and access for all. Healthcare for All is very active in a number of different coalitions. So we work in coalition to help advance health access. We've been instrumental in defending the Affordable Care Act and advancing Medicaid or Mass Health here in Massachusetts. We help to improve oral health care benefits, help improve oral healthcare services for our immigrant population here in Massachusetts. Then we do some work in children's health. We also do work in to help improve healthcare affordability and prescription drug affordability. And really our main source of getting to know people across Massachusetts and really do some direct service is through our helpline, which is a service that provides counseling for anyone that needs assistance getting onto public benefits, namely Mass Health, in English, Spanish, and Portuguese. And we provide this service Monday through Friday, 9 to 5, and there's our phone number there. So if anyone knows of anyone who needs some assistance getting into public benefits or even just walking through the application process, feel free to give our counselors a call. So what is the Health Justice Campaign? So originally, this campaign was actually inspired by a really impressive and inspiring grassroots campaign back in 2017 that rose up to defend the Affordable Care Act and Medicaid from attack from the previous federal administration. This was a very important moment in protecting healthcare as a human right when there was a very organized, broad grassroots movement that was made up of people who were recipients of the Affordable Care Act, as well as allies. This movement was also led largely by, people of color, various communities of color, people with disabilities, and just this really impressive grassroots moment where people that were acting in solidarity under the idea and belief that healthcare is a human right awarded to all of us, really rose up and defended the ACA and Medicaid. And, Healthcare for All was also a part of those activities and that grassroots organizing effort. And, we realized, if that's possible for grassroots solidarity to be on the defensive so successfully, what can we do to look proactively into the future and start organizing around a health justice agenda so that we don't always have to be on the defense, but we can actually start looking into the future and plan something new. And so the way that Healthcare for All approaches health justice is that, justice means something a little different to everyone based upon their own lived experience. And so we believe that, there's no one definition to what health justice means, but those that are most directly impacted by injustice are the sources of, identifying solutions to advance health justice. So that being said, we really want to make sure that this campaign is driven by communities or individuals that are directly impacted by injustice. This campaign is also responsive to the needs of the moment. So before COVID-19, we were organizing a broad grassroots coalition similar to the one that I described before to be on the defensive for the ACA. But this broad coalition was starting to look at a few different themes that were coming out of our community conversations around, what people were experiencing in regards to injustices in the healthcare system. And we were starting to put some priorities together. We were looking at legislation. We were really starting to build a campaign. And then COVID-19 hit. And we realized that, we weren't able to look too far into the future because there is an immediate need to address the challenges and disparities as COVID-19, it amplified those existing disparities, and we needed to be responsive to that immediate change. So with that change in mind, we launched the Health Justice Academies, which I'll get into in a moment, which is largely web-based. It's meeting the needs of the moment. And I'll get into a bit more into the Academy in a moment, but really the third pillar of this health justice campaign is that it really is grounded in consumer needs, collective action, and solidarity. So the understanding that, if there is an injustice that is really only prevalent in one particular community group, it is on all of us as those that want to advance health justice to be supporting that community, even if that injustice doesn't affect us directly. And so by acting in that solidarity, we want to advance the idea that we're only free when all of us are free. And so, yeah, going into the academy. So as I said, when COVID-19 broke out, we largely shifted into a digital organizing format, which is a little different, but I think we've been able to, use this otherwise challenging time as an opportunity to continue to advance health justice. And the way that we've organized these communities are these academies is basically my role as an organizer is to meet with different community groups, understand the injustices that they experience on a day-to-day basis, and then start to plan these academy sessions around particular themes that come out of those conversations. So I'll get into some of the topics that we've decided on in a moment, but the main goal of this academy is to build up grassroots power through educational modules on specific health justice topics, as I said, that are informed by community needs. We tend to do these in a month-long series or a season, as we call them, and we do try to include themes that have a particular strategic relevance to them as well. So we want to talk about things that might be up for a hearing or up for a vote, or there's certain bills that have a lot of momentum, and we're trying to throw our support behind that effort. And so that shows that need to be flexible and adaptable, but it is always grounded in the need to build up grassroots power. Second goal, so we want to equip participants with new skills and experience to engage in health advocacy. And later in my presentation, we'll talk about ways that everyone, everyday people can get involved in advocacy. So we'll get into that in a moment. And then we also provide some leadership opportunities for our participants through what we're calling our language liaison program, where we understand that not every community in Massachusetts speaks English. And so even though that we're presenting the academy sessions in English, we have some dedicated funding to fund our language liaisons to kind of be a liaison with different communities that speak languages other than English and translate and communicate these resources so that we can have an even broader impact. And so, as I said, since this is really grounded in community needs, if there's anyone here on the call today, I would love to hear just in the chat any ideas. Just think about when you hear the words health justice, what does that mean to you? What does that evoke? What maybe moments where health justice was achieved, or an injustice that you think needs to be worked on further? And we'll get into in a moment what sessions we've done in the past around the Health Justice Academy. But when you're looking through those topics, if there's an area that we just haven't touched on yet, or something that you really want to learn more about, also write that into the chat, and we can start thinking about, okay, well, is there a partner that's working on this initiative that we can have a dedicated session on in the future? So just want to encourage everyone to think, what does health justice mean to you, and what would you really like to learn in a future academy session? So feel free to throw that in the chat, and maybe we can share some of those as we're talking about the topics that we've already covered. So I know this is a long list of topics. We've been very busy this last year. And as I said, injustice takes many forms and is felt in many different ways. And so, a lot of these topics were informed directly from community groups. A lot of these were obviously responsive to the needs of COVID-19 and the changing challenges that COVID-19 presented. And some of these are also just longstanding health justice issues that Healthcare for All has taken on and is currently actively involved in campaigning around. So, we talked about eligibility for public health insurance, how to get onto Mass Health, the application process there. That was hosted by our helpline counselors. We've now had 2 dedicated sessions about immigrant healthcare, and the public charge rule, which thankfully was recently knocked down in federal court, so we don't have to worry about the public charge rule anymore, which is fantastic. So anyone that works in immigrant healthcare justice, understands the gravitas of that happening. So that's really great. We had access to essential health services during COVID-19 session. That included accessing oral health care benefits, changes to prescription drug access with the executive orders that were coming out of Governor Baker's office, and just the changing kind of insurance landscape as it related to COVID-19 testing and treatment. We had a dedicated session on how to manage medical debt. This was in partnership with a group called Health Law Advocates that I would recommend people check out if they themselves or anyone in their community is having difficulties with medical debt. This is a great free resource where they have counselors that can help talk through legal options to help remove that medical debt. We had a dedicated session on access to food and nutrition during COVID-19. This is a very rich area of advocacy in Massachusetts. There's a lot of really great food justice groups here, and some really great initiatives around advancing food justice particularly. Access to housing and the need for an eviction moratorium. This was also very important. This was back in October we did this session, and this was leading up until the current eviction moratorium was actually ending in Massachusetts. There was a federal one that was ending in December, but this was trying to help find some dedicated funding and push the governor's administration to lengthen this eviction moratorium. Unfortunately, it did not lengthen, and there has been a very significant increase in housing challenges in Massachusetts. So that's still a very active fight. We'd had a great session on investing in our recovery campaign with Raise Up Mass. This is a coalition that's working on, they were calling it their Invest in Our Recovery campaign. They had some really interesting proposals to change the way that certain public benefits were financed, knowing that because of COVID, the state budget was going to be in a very large deficit this year. And this group was saying, well, rather than cutting public benefits, as a result of that deficit, which would have a very inequitable impact on communities of color and recipients of Mass Health, what can we do to think about, changing the tax system in Massachusetts so that, we can raise more funds rather than start cutting these essential public programs. And then obviously leading up into the national election, we had a dedicated session on Vote for Your Health. And then this then leads into our last session, which we just finished in March of this year. So we had a session on how to improve healthcare affordability, which this is a very active campaign area for Healthcare for All. And so, anyone here that has challenges with affording their own healthcare coverage, whether it's through out-of-pocket costs or a high deductible health insurance plan, please reach out, because this is an active area of campaigning for us at Healthcare for All, and we have a lot of really creative solutions to help improve healthcare affordability. And as I said, we have another dedicated session on barriers to immigrant health and the need for safe communities. Then we had a dedicated session on oral healthcare challenges and the need for dental therapists, which is a new oral health practitioner that would help improve access and representation within the oral healthcare workforce in Massachusetts. And then our last session was the need for anti-racism in health and healthcare advocacy. And this was a really great session that I'm happy to share the recording of, and is going to be an active area of work for us at Healthcare for All, and hopefully everyone that wants to advance health justice. So feel free to throw in the chat as well if you have any questions or things you want to learn more about. All of these are recorded as well, so I'm more than happy to share these recordings with any members here if they want to watch or learn more about any of these issue areas, but these are the topics that we covered so far. And so really quickly, I know this is a lot of information, but this is Healthcare for All's current package of different health justice priorities. So this is what we'll be taking on for this next legislative cycle. And these are just the bill numbers and names of the bills. So if anyone here wants to learn more about our active campaign areas, I also included a link to our website at the bottom. But our large kind of buckets of work is around improving healthcare affordability, with a few different bills that would be able to do that, including a dedicated set of bills to work on prescription drug prices, improving healthcare access through the removal or changing of the prior authorization process, improving maternal health and postpartum care, improving care for children with disabilities, and then improving oral health care. So if anyone would like to learn more about these different legislative priorities, there's our contact us link at the bottom, and I'll make sure to include my email at the end of the session as well. And I did see we did get a comment, so thank you, Mia, for sharing what you think what health justice means to you. So I'm going to read it for everyone in case people haven't had a chance to read it in the chat. Healthcare justice means to me healthcare that covers everyone, definitely, and is affordable, and also that healthcare is recognized as a human right enjoyed by all of us. I certainly agree with you there, Maria. Thank you for sharing that. Great. So that's really the background to our campaign. That's the work that we do at Healthcare for All. We're going to be doing more academies into the future, so please reach out if you have ideas or would like to get involved in this work. Okay, Patricia has a great question here, so I'm happy to answer. What work does Healthcare for All do to help immigrants who are eligible for affordable health insurance learn about and enroll in it? Great. Are there opportunities for volunteers to help with these efforts? Great question, Patricia. So we do have our helpline counselors is really probably our main avenue to assist our immigrant communities across Massachusetts, particularly our communities that speak either English, Spanish, and Portuguese. So understanding that there's more language needs in the state, but those are the languages that we're able to cover with our current funding. And so if people want to help out, that's a great question. I would say right at the bottom of this link, the hicfa.org/contact us, reach out, because there actually is a lot of ways for people to get involved, especially through our different campaign areas. Some of these are particular to immigrant populations, and then we do a lot of dedicated educational sessions for our different immigrant communities. So feel free to reach out to us on the contact us form, and we would love to find a way for you to get involved. And I see, Kathy, you have your hand up. Would you like to come off mute and share with us? Kathy Schneider, would you like to? I see your hand is raised. And you're muted. I'm sorry, I can't hear you. There you go.
Chris, I was just reading the chat, so I wasn't actually raising my hand to speak, but
okay.
on the camera, it looked it is because I had to reach for my chat button to
sure.
read what the other people were writing.
Oh, of course. All right. Thanks anyways. Great. Thanks for everyone's questions. I don't know if there's any other questions, feel free to keep them in the chat. Otherwise, we'll be moving on to our next section of the presentation. Great. So this is more of the advocacy section. This is ways for people to get involved and contact their legislators. So, and really grounded in the power of storytelling. Storytelling is really the greatest tactic that every person has in their tool chest. We all have stories that we're able to share. And by being very strategic and also very emotionally driven in our storytelling, we can have a really great impact in influencing legislators, since at the end of the day, they work for us. We are their bosses, and they need to hear from us so that they can take action in the way that advances the needs of their constituents. So before I get into the presentation around storytelling, I actually wanted to share the stage with two members of Faith That Does Justice to share a quick story around some experiences that they've had with the healthcare system. So Teresa Chaklos, are you on the call, and would you like to share with us your story? I know she had some trouble getting onto the call. So maybe in the meantime, is Paul Connor, are you on the call, and would you like to share with everyone?
I am. I am. Thank you, Chris. And, thank you all for being here. I hope I just don't sound like a complainer, but I'm a lawyer. I was the managing partner of a 12-lawyer firm, and I have served in various capacities on nonprofit boards, including as board leadership. I'm presently the chairperson of two nonprofits that are giving health care to emotionally disturbed boys in one, and the other is individuals on the severe aspect of or spectrum of autism. So I guess the first thing I struggle with in terms of looking at our healthcare policies is that, what is healthcare? Because our Catholic agency refuses, based upon a ministerial exception and their belief, to fund all healthcare. Now, we do not insist that our employees in the healthcare agency practice the Catholic faith at work or in their homes. Our overwhelming population in terms of our census of employees are immigrants, first generation of immigrant families. They are, and there's a strong cross sections of Blacks, Spanish, and I don't think we have any American Indians or Asians, who have, all of whom may have very different beliefs, but they all need healthcare. And so the issue and the challenge for me and where I struggle is finding that definition of healthcare that allows people to, while I'm consistent with my faith, that also allows people to reach the healthcare that they need in their particular circumstances or their family. Now, one of those issues is insurance coverage, and there, when I was running our law firm, I'll tell you that we paid 100% of the individual health insurance premium for all of our employees and half of the family plan. And the reason that we did that was that we believe that, again, that healthcare should be available to our employees, that it was, there was a selfish part of it, and that we were able to attract and keep, employees. But it was also, but basically it's a matter of principle, in terms of what our beliefs were. We did not have high deductibles. The Catholic agency I'm involved with now requires these folks who make $15, $16 an hour to pay 20% of their healthcare premium, which some people say, well, that's much better than what we see in industry. But we're not industry. We're a nonprofit Catholic agency. And just for, I got one of my 5 children works for a company, and, they provide healthcare. It costs him $7,500 a year. Had two boys that at various times had health insurance through a branch of the federal government. It was essentially healthcare insurance that was great so long as you didn't need it. In the Catholic agency I'm involved in now, we pay there are huge deductibles, and it really, I'm talking, $500, $1,500, costs that are out of reach really for our employees. The result is that of our over 100 employees, we have 16 that are taking advantage of the healthcare insurance that we provide. And the reason is that they go, they have to find it someplace else, or they just go bare, And Massachusetts is fortunate in that it has a very good healthcare insurance structure. And our Catholic agency has no hesitation to thrust its employees on the state system through Mass Health, all right? Even though our Catholic agency does not pay taxes on its income, does not pay taxes on its real estate, but no hesitation whatsoever say, go to Mass Health. And our wages are such that many of our employees qualify for that, and now we're getting further pressure that we see in terms of other marginalized people such as transgender and binary people. And there's a push by the Catholic Church and the bishops to carve out, again, healthcare for those individuals. So that, my problem is, and my wife and I were at a rather intimate, I was telling Chris, an intimate meeting and one of the participants was a man who was undergoing the hormone treatment. And when you listen to his story as to the impact that it has had on him, the impact that it has had on his family, many of whom have been told that he has a disorder and therefore should be shunned, the difficulties had with employment. For the church to say we are going to marginalize him for in terms of healthcare makes no sense to me. And so that is my conundrum. I hope people have some suggestions as to answers. And I appreciate very much the opportunity to share a bit of my story in trying to advocate for healthcare for all.
Thank you, Paul. Thank you so much for sharing. Teresa, would you like to share? I know you're able to join us.
Yes, hi. Can you hear me okay now?
Yes.
Okay, great. When I spoke with Chris, he discovered that I had several stories, but we're picking the one that was most recent. And but they all do have the same theme, and that is getting access in general to the actual doctor. The most recent incident was I had a follow-up appointment, or so we thought. I had an appointment with a specialist who took some tests and said to me, okay, call in a couple of weeks so that we can discuss, the result. You don't have to come in. And great. So a few days later, I get a phone call from the doctor's office. And the young lady said, well, the doctor, I'm calling to schedule your follow-up appointment. And I said to her, well, I don't really need an appointment. She just needs me to call for the result. And then she says, well, she changed her mind. So I make an appointment for last Wednesday for 9:45. And as some of you may have experienced this, when you go now for appointments, you have to, drive to the garage. You have to call again from the garage and then be screened there and then wait for them to call to have you come up. So I get upstairs at about 9:40, and the doctor's running late. So I wait until 10:20 to be seen, and they put you in the room. And as the doctor comes in the room, she goes, "Oh, you didn't have to come back." And needless to say, I was pissed. And I said, okay, you folks need to get yourselves together here because my time is worth something. And I said, I'm telling you now, I am not paying any out-of-pocket money for this visit. And somebody needs to reimburse me the cost of parking. Because I had to wait longer, the parking was $7. And then because she was running late, I'm sitting in the waiting room that had several other people there, including people from like some ambulance service, which is further exposing me to COVID. I have not yet been vaccinated. So I did not appreciate that. So as soon as I got home, I called what's called some places call it the patient relations office or the patient advocacy office. And I also called the billing office. And I spoke to the billing supervisor and I told her, I'm telling you in advance, if there is an out-of-pocket cost outside of what my insurance pays, I will not pay it. Do not bill it to me. I should not have been there. This is your mistake. And then I called patient relations and I let them know, and I also advise them what my time is worth. As a mediator, I charge $100 an hour. Is somebody going to reimburse me that? No. So even though a person's a doctor and I am painfully aware because I have a family member who's a doctor of what they have to go through to get their education and to be certified and all of that. But guess what? My time is important as well. And not only that, during this coronavirus, I'm limiting my exposure so I don't get sick. And then to have me physically come in for an unnecessary appointment is unacceptable. So right now, the billing office has a little flag on my account. And right now, so far it says 0 balance. So I'm hoping that works. It's worked for me before. I've been in Maryland. I've been in Massachusetts now for almost a year. I moved up here last year at the height of the pandemic from Maryland, but in Maryland they had a similar office, and I found them to be helpful. But I feel that sometimes who the doctors hire as their office assistants, those sorts of folks, a lot of times they're messing up, and either the doctor's time is wasted because they messed up, as well as the patient's time. And I feel that something needs to be done to monitor these folks. And if you don't know how to answer the phone, if you don't know how to make appointments, if you're not computer savvy, perhaps you should be doing something else. And that's my 2 cents on the subject.
Thank you so much, Teresa. Both of you have such powerful stories and great examples of how, storytelling can have different levels of impact, right? Like there's different types of advocacy that we can all engage in. We heard Paul's story of, how there's these very expensive health insurance options and there's broad systemic issues with the lack of specialized care for, transgender folks in Massachusetts and really speaking to the need for special dedicated trainings and services for every different community group, but particularly from this story, transgender folks and their unique healthcare needs. So that's really speaking to a story that's calling for broad structural change. There might be some pieces of legislation that can be changing that, or we would need new trainings for doctors that would be inclusive of transgender folks and their specific needs. And then from Teresa's story, her personal advocacy. Sorry, I'm getting some messages. From Teresa's personal advocacy, she, was able to actually get a bill taken back. Her advocacy allowed for an unacceptable charge to be removed from her account, and she was doing personal advocacy to say this is unacceptable. You need to take this away. But then also Teresa's story is also bringing to some need for systemic change to say, hey, the people that you're calling to people that you're hiring for these roles, make sure that they're being respectful of people's time and that they have proper training so that they can stop this problem from happening in the future. So those are two great examples of stories that are speaking truth towards the need for different types of healthcare change. So thank you, Paul. Thank you for Teresa for sharing. We're gonna move on to the rest of the presentation where we can talk a bit more about what makes a really powerful story, and how can we really leverage our personal lived experiences to advance health justice. So I'm going to get more into the power of storytelling and what makes a really powerful story. So the benefit of storytelling, as I said before, is that we're all natural storytellers. We're hardwired for storytelling, and we all have them. We all come from a personal lived experience that has informed the way that we live our lives and the experiences that we have. And so the most powerful aspect of stories is that their ability to move others to take action. And so how do we move someone to take action? So the way that I've been trained in storytelling, this is all based upon a really amazing organizer named Marshall Gans, who teaches a course on organizing and the power of storytelling. But this model really tries to link two different aspects of a story. You want to be strategic. You want to make sure that this story is speaking about an issue that speaks to the needs of the moment and really talks about, well, this is why this needs to change, and this is how this needs to change. And then, but it also needs, you can think of that as the head. It needs to be the strategy aspect, the very logical aspect. Now, the narrative, this is the heart. So this is where you really want to tell the why this is important. This is why this is important. This story has impacted me personally and has had this negative effect in my life. This is, I've felt this. You want to be detailed. You want to speak to, different motivations of different players in this story. And you really want to link that narrative, that very powerful personal story, with the strategy. So saying, and this is why this is important for you to take action now, so that the person that you're speaking to, it results in action. So you think of the head meeting the heart, then results in action through the hands. Just a way to think about how to be framing and putting our stories together. Now, the most powerful stories, as I said, combine the strategic head with the empathetic heart to engage the actionable hands. And so in other words, stories can move other people to overcome whatever barriers might be stopping them to take action in just ways that statistics and evidence really cannot. So, I'm in countless meetings with legislators throughout the year, and I'm there sometimes as a policy analyst or as a person working on various legislative campaigns, and I can be spewing different statistics about the increasing cost of insulin and what it used to cost in the 90s and why insulin access needs to be made globally accessible since it's at its 100th year anniversary. Like, I can spit out all this evidence as to why insulin is a problem, but it's not until I share a personal story of saying, I have 3 months worth of insulin in my refrigerator right now. And if I were to lose my health insurance, I would have to go to Canada to get love. I would have to go to Canada to get my insurance, to get my insulin, to be able to stay alive for another week. Like, that is a personal connection to the issue that when that legislator is then driving home that day, that person's going to be thinking, wow, I can't believe, like, that's how important insulin is to that person. You want to make that type of emotional impact on someone that drives them to be thinking about it and then take action. So the way that we can think about this is, there might be some action inhibitors of that people might be experiencing. So they might be thinking, they might be living in inertia. They're like, I'm not going to be able to take action. There's nothing I can do with this. And by sharing a really powerful story, they're saying, whoa, this is really important. I need to take action now. So with my insulin story, if I say I'm out of insulin in 3 months, I need a solution now, that person is saying, oh, wow, I can't wait. I can't sit on this. I can't be, acting in inertia. This is urgent. I need to take action now. Another example of a way a story can have an impact is if someone feels apathetic, they say, well, what can I do? I can't do anything. There's nothing that I can do. I don't know why people keep calling me. By sharing a story, that's really, is impactful and really links that head and the heart, you can have that person empathize with your story, say, you know what, this is an injustice. This is unacceptable. There's something we need to do. I need to do something about this. And you kind of move them out of that apathy to a place of kind of righteous anger. Could also move someone from a place of fear. So thinking, oh, well, we can't take on the pharmaceutical industry. We can't take on these large moneyed interests. Like, what can I do? What am I going to be able to do? And by sharing a really powerful story, like, you know what? I think there is something that I can do. And it just drives people into a place of hope and a place of action. Now, another example that this is a way a story can move someone out of isolation into solidarity. So, every time that you share a story, you never know the people that might resonate with that story. So, if even Teresa sharing her story tonight, if there's people on the call today that have gone through a similar experience, they suddenly realize that they're not alone. And then there's more people out there that have had, these same problems or challenges with the healthcare system. And then suddenly they're like, whoa, that's not just me. There's other people out there. Maybe I can go meet with those people and do something about this. Maybe I can start organizing my community around these shared problems and the need and a shared vision for how it can be better. And then suddenly you're starting to build community power through this solidarity that can even create a bigger level of change. And then this last example, so self-doubt. So, thinking, what can I do? There's nothing I can do. And then YCMAD means you can make a difference. So really empowering someone with the ability to make a difference. So those are all examples of what stories can do. And so going into, we're going to now start thinking about our own stories. What stories can we tell about an injustice that we've experienced in the healthcare system? So, everyone I know has pens and paper, or if not, you can just kind of think through this, start thinking, start asking yourself these following questions. What challenges have you experienced, and why was it a challenge for you specifically? So this is called the story of self. What calls you to the work of healthcare advocacy? What calls you to the work of advancing health justice? And you want to ground that in your own lived experience. So for my example, I was diagnosed with type 1 diabetes at 5 years old. I quickly realized that insulin, which my body is dependent upon to stay healthy, is very, very expensive. And if I don't have insulin for a couple of days, my organs begin to shut down and I would actually die. So I'm very healthy right now, but if I don't have insulin, it is a life or death experience for me to have affordable, accessible healthcare. And that brought me into the advocacy of understanding that we all have needs in our healthcare system, and health is a human right, and we should have access to the healthcare services that we require. So the next question is, why is meeting this challenge urgently needed? So as I shared, with my insulin story, if I don't have insulin for a matter of hours, I start to feel sick. If I don't have insulin for a matter of days, I will die. My organs will shut down and die. And this is unfortunately a situation that a lot of people around the world are still experiencing due to a lack of affordable insulin. 1 in 2 people around the world are rationing their insulin. So just to give some context there, this is a very real reality for a lot of people across the world. And that really talks about the story of now. Like now we need to be doing about this a long time ago, but now it is especially important for us to take action to help improve insulin prices and other prescription drug prices. And the third question is, how would meeting this challenge make us all better off? Well, to continue with my example, if we were to have affordable prescription drugs, including insulin, then people wouldn't have to worry about making ends meet on a month-to-month basis. People would be able to have the life-saving medicines that will allow them to thrive and be contributing members of their community and to live a long and robust life without the stress of having to always jump from job to job with a really good health insurance plan and not have to kind of result in all of this scarcity-based decision making. So you really want to think about yourself. You want to think about the moment that you find yourself in, and how would the world be a better place if what you want to see changes. I've gone into a lot of these examples, but you really want to be as specific as possible. So think about an image or an experience or a scene. You want to say, when I was doing this, such as during the pandemic, or as a physician or as a patient, I say as a person with type 1 diabetes, and then I've witnessed something or I experienced something that really helped define, my perspectives. Like you really want to ground it in your own lived experience. And then as with all storytelling, you really want to have a beginning, middle, and end. So this experience that I just described to you really led me to realize that this thing needs to change. And that's why I support this initiative and care about this problem that I'm talking with you about today. So you want to have a beginning, middle, and an end. You want to make it personal. You want to make it emotional. You really want to make sure that this story sticks with the person that you're talking to, so that when they're driving home at the end of the day, they're like, whoa, that person's story really got to me. I need to do something about this. And as I said, I think I just said this, but don't be afraid to share emotions about the experience you had in your personal story. You really want this story to stick, in a way that statistics and figures and graphs might not be able to. And then this is where the strategy meets the heart, right? So you really want your story to link into the demand that you're bringing into that meeting, and really try to include some suggested talking points so that you can really hit the rational part of that person's mind, saying, whoa, you're right. Like insulin is as important as water. Like if this person doesn't have water for 3 days, their organs will start to shut down. If they don't have insulin for a number of days, similar things can happen. I need water. This person needs insulin. Like try to link it in their mind and then say, oh, there's a bill that would help improve prescription drug prices in Massachusetts. And I could be a co-sponsor of that bill. I could be a champion for people who need this medicine here today. Oh, you're right. Maybe I should do this. I really connect with that story. And to be honest, this has actually happened in the state of Massachusetts. And we have prescription drug price legislation that has been driven by patient advocacy. Myself and other people with type 1 diabetes have been pushing for this for a long time, and we're seeing some really great headway in this space. So just wanted to share that storytelling does have an impact, and you just got to keep pushing and keep sharing. So this is another strategy that people can use just when you're starting off. I know we're coming up on my time, but this is called the 27-9-3 rule. So if you want to you can also, it's called like an elevator pitch. This really helps to make your point persuasive. You want to try to share your story. And this is for, advocacy, maybe with people that you might not have a dedicated meeting with. If you have a meeting, you might have a little more time, but it's generally helpful to try to tell your story in 27 words with a time frame no longer than 9 seconds. I know that's really short, so this is really good to just kind of pitch people on an action or an activity or a campaign that you're working on, and then that can just open the door to more conversations. And then really try to hit 3 points, just so that it really can, if you have a short amount of time, this is just a good strategy. So people can, try their own 27-9-3 example for something that you are interested in, and maybe you can share those 27 words in the chat with us while we close out. Yeah, so we can all practice here. I know we're running out on time, so if people want to write their 27 words into the chat, feel free. We're also, I believe, sharing these slides afterwards, so you guys can all keep these for you. Because I really wanted to get into just another avenue where you can share your story. And that's actually in publishing your story in local media outlets. And so a really amazing tool for everyone to get your story out there and heard by a greater group of people is by publishing what's called a letter to the editor. If anyone here has written a letter to the editor before, feel free to write into the chat where you've published or your experience with that. I'd love to hear if people here have experience with this. I'll be getting into it briefly on the call, but and here's a few other options. You can do op-eds and columns and editorials. Those are a little longer, so we're just going to talk about letters to the editor today. So a letter to the editor is typically shorter than an op-ed, and it's written in direct response to an article that's been previously published in a particular news outlet, and rather than a general news topic. And it's always written by a reader or a concerned citizen. So anyone can write a letter to the editor. You don't have to actually work for that newspaper. It's for the public to get their word out. And just, there's a lot of tips here, but the way that I think about it, if you read an article that you really like, well, this is really not, approaching this topic very well, or this article is, I really disagree with what's written in this article. I have a lived experience that can speak to a different perspective around this issue area. That's a great opportunity for you to write a letter to the editor in response to that article. And so, if I'm reading an article saying, I think we can keep insulin prices really high, I would say, well, excuse me, I don't think that's a good idea at all. And then this is my experience, and this is why I don't agree with that. And you do always want to include your contact information in the letter to the editor, because this is a great opportunity for you to start even organizing, and people can reach out to you if they really resonate with that story. And then you're already building some power within your community. And what else is great about a letter to the editor is that, especially with state House representatives, so not federal delegation, but people that work here in Massachusetts, they're always looking in their local newspapers for their constituents' opinions. And so if you write a letter to the editor that's targeted or includes a reference to that representative, it's pretty likely that rep is going to read that LTE and going to know that, like, oh, I'm getting a lot of letters to the editor talking about this issue. This must be something I need to take up. And that's another way to kind of, leverage power against or towards our policymakers and have them uptake an issue. So here's some more examples here. They're actually very short. They're only 150 to 200 words. So, anyone can write these. They're very short, just meant to be a paragraph response to an article. And so you want to be concise. You want to refer to the article previously published. You want to be very personal. So try writing that 27-word strategy like we've been saying, and really include a call to action. So you want something to change because you've seen something wrong in an article. My lived experience speaks to how that needs to change, and this is what I want to see change. So you want to really always include that demand so that the heart really meets the head and that people are then taking action. Here's an example for you all to read. It'll be in the follow-up slides, but this is a LTE that we published at Healthcare for All recently. And that's my presentation. So I know I might have gone over time a little bit, so I'm sorry if that's the case, but this is my email. Feel free to write to me if you want to, write an LTE and learn a little bit more, or get involved in any of Healthcare for All's campaigns. Thank you, everyone. I'll stop sharing now.
Thank you, Chris. That was very informative on how we can all act for health justice. Following this session, you'll all receive an email with places to look at for volunteering if you'd like to get involved in the health justice movement, including, of course, Healthcare for All. So this is a list of programs you'll receive. You'll get that in an email, so no need to write anything down. And I just want to turn it over to Father Peter to wrap us up before we go.
I believe he's muted. Peter, do you want to go on mute? I'm sorry.
Sorry about that. If you didn't hear anything I said, I want to thank everyone for being here tonight, and I encourage people to really, examine your own life yourself and what you might be able to do to help people in need. There are a bunch of options tonight, and I'm sure that either through Michelle or Chris, we can hopefully get people to get involved. It is important that we really live faith in action to really try to help those people who are really struggling out there. We've had viewers tonight, not only from Boston, but from outside of Boston. And, feel free to be in touch if you have questions that might be applicable to where you're living right now. So I'd like to thank everybody for being here. Remind you that we appreciate your walking with us as we try to live faith in action. We will have more community meetings in April. We're going to really talk about the immigration issue, and we really encourage you to walk with us, to be present at that. And so again, I'll end by thanking everybody, and look forward to seeing you as we move along. And hopefully there'll come a time soon where the vaccinations in this country reach a point where we can all gather together again. So good evening to all. And again, thank you very much for being here. Chris, thank you for your time.